everyone, welcome to another episode of Your Health on Impact Africa Television. I am Precious Obatuishe, your favorite host on this program. Of course, we started this program last week and it comes up every Tuesday from 3 p.m. to 4 p.m. Your Health, this is a show that is aimed to help you acquire more knowledge about the health sector, address health problems, and most importantly, your overall well-being. So you don't want to miss out on any of this episode. And then last week, we looked at a topic talking about the care of your eye, eye health, and how you can take good care of your eye. And I'm sure you have been trying your best to put all of this into action. And then today's topic is also very, very important. If you are just joining us, trust me, you are right at the, you are the right channel. You're watching the right program this beautiful afternoon. Remember, like I said last week, that the eye is the jewel of the body, which shows how important the eye is. And because we appreciate this part of the body and we value it so much, we are going to be taking you through the series of some diseases, some human diseases, the way they affect the eye, preventive measures, and possible treatment. Last week we looked at the general eye health, like I said earlier, how we can take good care of our eye. So going further, we want to look at some human diseases and how they can affect the eye. So today we want to look at diabetes and the eye. What is the connection between diabetes and the eye? When you are a diabetic patient, what are the things that you need to look out for? What are the practices that you need to involve in? How often should you go for your examination? I mean the eye examination, and then the treatment, the necessary treatment that you need to take. And then let's look at statistics. According to statistics, about 422 million people worldwide have diabetes, and about 1.5 million deaths are directly attributed to diabetes each year. Both the number of cases and the prevalence of diabetes have been steadily increasing over the past few decades, and then which relatively means that there is high rates of people at risk, talking about vision impairment, blindness, as diabetes has the distinction of being the leading cause of blindness. And that is why we are looking at this very, very important topic today. And then joining me to discuss this important topic today, I have right here with me in the studio a special guest, a well-seasoned and experienced consultant ophthalmologist. He is from the University College Hospital. He was right here with us, last week in the studio, where we talked about the general eye health and how we can prevent eye problems. But you will be seeing more of him because, like I said earlier, that once you take you through the series of human diseases and how it affects the eye. So you shall be seeing more of him on this show. Of course, no other person but Dr. Olumide Ologududu. You're welcome to the show this afternoon.
Thank you. Good afternoon.
It's good to have you on the show.
Yeah.
Okay, we want to look at diabetes and the eye. The connection, like I said earlier, the connection between diabetes and the eye. If you had a diabetic patient, the things you need to look out for, the management, the treatment that you need to, put into place. But let's start by understanding diabetes, itself. What is diabetes itself and how does it occur?
Thank you. Diabetes is appropriately referred to as a microvasculopathy. It's a group of conditions associated with elevated blood sugar level and with subsequent end organ damage. So it's a chronic condition. Now, a microvasculopathy, in the sense that it has a predilection, has a special choice for small vessels. And that is what makes it very important as regards the eye, because the eye is very well privileged in terms of blood supply. I'll get there. So diabetes, like quoting the statistics I referred to earlier on, 422 million worldwide. So it's quite common, and the affectation of the eyes, it's more common in low income and middle income countries, of which Nigeria is a part of. So it's a condition, is a metabolic disorder, usually due to the absolute or relative deficiency of insulin. So insulin basically is an hormone, or let's call it a chemical, secreted by an organ, again in the body, called the pancreas. So this pancreas secretes the insulin. Now this insulin is like a gatekeeper, or it's like a director. Let's call it a director. So it helps to direct blood sugar, or rather sugar in the blood, into the cells. So in the situation that you have an absolute or a relative deficiency or lack of this insulin, sugar, which is needed for metabolism, will not be able to move from the bloodstream into the cells. So, but you require it in the cells so that the cells can perform their day-to-day activities. So essentially what you now have is what may be regarded as poverty in the midst of plenty. So you have a lot of sugar floating in the bloodstream, but none of it, or an adequate amount of it, is not moving into the cells for use, for metabolic uses. So that causes the different complications that can be attributed to diabetes. So basically, diabetes is a situation where you have plenty, but there's poverty in that midst of plenty, because the cells can absorb it, the cells can use it, and because of the side effect of that excessive blood sugar, it cannot have complications, it cannot affect small blood vessels in the body. So it cannot affect organs like the heart, can affect the kidney, can affect the eyes, which we're looking at today. Yeah.
Okay, in a simplified form from all you've said, diabetics has to do with high blood sugar.
Blood sugar.
Blood sugar. Okay, let's now look at the link between blood sugar and the eye health. What's the connection between the two?
Yes, like I mentioned earlier on, excessive blood sugar can affect the small blood vessels in the eye. Now, so let's get to the eye now. So this is, I have a model here. So this is an eye model. Now the eye is one of such organs that is one of those organs that enjoys a very rich supply of blood vessels. So so this is what the eye looks like from outside. Of course, it's not this big. This is just a model. So you have this outer part, has three main walls. You have the sclera. Then, of course, you have the choroid. Then you have the retina.
Okay.
So now the choroid is very richly supplied with blood vessels. So you can see all of these things, you know, this red, and so these are arteries and veins. So the most vascularized part, that is the most supplied part of the eye with blood vessels, is that area of the choroid. It's actually choroid, ciliary body, and the iris. So there's a very, very rich supply of blood vessels. So that is why the eye is one of those organs in the body that you can actually take a look at blood vessels in the body directly. It's so if I want to, of course, without having to tear a human being apart, the only part in the eye that you can actually see blood vessels at a glance during a clinical examination is the eye. So what that means is, because diabetes affects, now we're talking about diabetes mellitus. Now there are different types of diabetes. Diabetes mellitus now. So because diabetes mellitus has a predilection for small blood vessels, and because you have a lot of blood vessels in the eye, small blood vessels, the eye is one of those organs that you can actually have an end organ damage due to elevated blood sugar in the body. So sugar attacks the blood vessels and causes a damage. So, but in addition to that, I'm still going to mention that, so that's what we call a diabetic retinopathy. But in addition to that, diabetes also has different ways by which it can affect other parts of the eye, which I'm sure we'll get to that point very soon.
You just mentioned diabetic retinopathy. Let's talk about there are other ones. Let's look at the macular edema. Is it the same? Is it the same signs and symptoms, or is it the same way that the retinopathy is affected?
Okay.
That these other ones affect the eyes.
Okay. Let me just perhaps just take it this way, because we're considering diabetes and the eye. The retina is not the only part of the eye, and that's why I started with a very brief anatomy of the eye. So the outer part, sclera, the choroid, and the retina. So, and the retina is actually and the other parts of the eye. You have this glassy part. It's the cornea. So the inner part, there's a muscle, that's the iris. Then if you now pry, so this is the optic nerve. This is the nerve that connects the eye to the brain. Of course, you have muscles, extraocular muscles here. So then you have the lens also. I forgot to mention today. Now, interestingly, diabetes can affect, when you talk about diabetes and the eye, we're not actually, before we cone in to begin to discuss diabetic retinopathy, the retinopathy is, let me see, I should be able to, I'm trying to, yeah, should be able to, yeah. So this is the way it works. So I have to put this apart. So this is the way it works. So I've opened the eye. Okay. So you see, so this is the retina you're looking at. So that's the inside. You see all those branch-like structures, you know. So these are blood vessels. So the blue ones are veins. The red ones are arteries. So that is the retina we're talking about. So, sorry. Yeah, so that's the retina we're talking about. So this is the inner part of the eye. So it's like you enter into a room and the walls are the retina. So that's what we're looking at. But before we get to the retina, like I mentioned, there are other structures. So let me just quickly run through them for the sake of time and all that. So quickly, so diabetes can affect any part of the eye. So you have people having, so from the lids, you have some people having some bumps on the eyelid. You know, some can be painless, which we call the chalazion. Some are painful, stye. So diabetes can actually cause a recurrence of this. These are actually infections of glands on the lids. Okay. Yeah. So you can have a recurrence. So for someone who's diabetic, you may have a recurrence of that. You can have recurrent. Then moving from the lid, you can have the lining covering the eyeball. Okay. So there's actually a lining, like a stocking. So we call that the conjunctiva. So you can have recurrent, what we call chronic conjunctivitis. That can occur. Then from there, the cornea, that's the outermost part, that the glassy part that I referred to. So the cornea, you can have wounds, ulcers, you know, what we call some keratitis, you know, superficial punctate keratitis, like small wounds on the cornea. Yeah, so that can occur. Then you can have recurrent corneal ulcers, particularly in those who wear contact lenses and are diabetic, you know. So then you now move into the eye. So we can now start talking about, you cannot have the iris. That's the muscle. You know, I mentioned iris, the vascularized parts of the eye, the choroid, ciliary body, and the iris. The iris is the muzzle of the eye. So when I'm looking into your eye, that black part, central part I'm looking at, is actually not the cornea. Yeah, the cornea is the glassy dome over it, but you now have the muscular part, that is the iris. So that it's the center of the iris. Okay, so this is it. So this is what we're looking at. So this is the iris. So I'm looking into your eye. So what makes your eye look black, or although they could come in different colors depending on the genetics, the race you belong to, and all that stuff. So this is what it looks like. So this is what the iris looks like. So it's a muzzle. So at times during diabetes, you can have blood vessels, new blood vessels forming on this muzzle. So we call it rubeosis iridis, new blood vessels on the iris. Then the center of the muzzle is the pupil. So this is where light enters into the eye. So in diabetics, you could have problems with the pupil, constricting.
Is that what causes blurry vision?
No,
for
no,
them?
not necessarily. That may not cause blurry vision.
Okay.
So the things that could cause blurry vision could be, you can now move in. Now talk about the lens. So the lens of the eye can absorb sugar. We call it sorbitol. Absorb sugar and become swollen. So that can cause what we call refractive errors.
Okay.
So you can have induced short-sightedness, you can have long-sightedness. That's why perhaps, I'm not sure if you've heard some people say that, particularly people who are over 40, they've been wearing glasses before, reading glasses, and all of a sudden they begin to say, oh, I just noticed I can read without my glasses being put on. That may be an indication that their blood sugar level has gone up and sugar has entered into the lens of the eye. It has now become swollen, and you now have a higher refractive index, and all of a sudden they begin to see better for near. So we call it like a form of second sight. So that could happen to the lens. But we have conditions also where the lens begins to get opaque, which is referred to as cataract. So diabetics can have early onset of cataract, or they can have their cataract being accelerated. Cataract, again, like I said, is when the lens in the eye begins to turn white. So this can cause blurry vision. So the refractive error can cause blurry vision. The lens becoming white, cataract, can cause blurry vision. Then we now move to the back of the eye, and then we've come to the retina. So you can have a diabetic retinopathy. Diabetic retinopathy, part of the diabetic retinopathy is a diabetic maculopathy or macular edema. Edema just means swelling. The macula is another portion in the retina responsible for the sharpest vision in the eye. So we call that the macula. So if that part of the back of the eye imbibes water and becomes swollen, yes, you can have its deterioration of vision and have blurry vision. Other things that can cause blurry vision in someone who is diabetic, as far as diabetic retinopathy is concerned, you can have a bleed.
Okay.
So people who have diabetic retinopathy can either be the two broad stages. There's what we call a pre-proliferative. Pre-proliferative means before you start having abnormal new vessels being formed. Then you can have the second stage called proliferative, where you now have new blood vessels being formed. Now, these new blood vessels are unlike the original blood vessels because they're so fragile.
Okay.
Yeah. So because they are fragile, they tend to break easily, and they tend to leak. So this leak can cause blood leak into the fluid in the eye, which we call the vitreous, and can have what we call a vitreous hemorrhage. So all of these things can give rise to blurry vision as far as diabetic eye conditions are concerned. And in some rare cases, you can have what is referred to as a diabetic papillopathy. So in other words, you have the nerve that I spoke about being affected, by diabetes, although that's not quite common. So all of this, that I've just quickly mentioned.
Okay, let's do it this way, because you've tried your possible best to explain how this work, in details. But let's do it this way. Let's look at, though you've mentioned some of those signs and symptoms, but let's dive into it the more. As a diabetic patient, what are the other things, the patient should look out for? That, this is a sign that my eye is being affected or will be affected by diabetes.
The calmness, I've mentioned everything actually.
Yes.
Yeah, so it can either be related to vision, it can be vision related, it can be non-vision related. So the non-vision related are the things I've mentioned, relating to the lids, the frequent discharge. You can have ulcers or pinpoint ulcers on your cornea and all of that. But the ones that are largely responsible for vision related, so vision related just means you notice that something suddenly goes wrong with your vision. So the two broad classification is, it could be that there's a gradual deterioration of vision in the event that you start to begin to develop a cataract, or you can have a sudden deterioration of vision. So in terms of vision complications, it's either it's gradual or it's sudden.
Okay.
So that's the way vision complications
Okay.
work.
How early does this signs occur? You know, as a diabetic patient, you know, you might not be going for eye examinations, probably because your eye, you feel everything is okay with your eye. But how early do you think these signs occur, so that someone who is diabetic can know when to start, you know, probably going for eye checkup?
Yes, to start with, a lot of the eye complications can be directly related to the blood sugar level control.
Okay.
Yeah. Now, you know, there are two types. With respect to diabetes mellitus, there are two broad types. You know, the type 1 and the type 2. The type 1 used to be called the juvenile onset diabetes mellitus because it occurs earlier. You know, it's more of a genetic thing, you know, and of course it's been found to be most likely due to the poor release or failure of release of insulin to mop up sugar from the bloodstream and convey it into the blood cells. So you can have that. So that occurs very early in childhood. So then you have the type 2, you know, which is the more popular type, occurring in individuals usually above the age of 40. But first, for a diabetic patient, usually the common symptoms of weight loss, excessive eating, excessive urination, excessive intake of water, you know, all of that, the general, then poor wound healing, all of that, the general. So all that would raise the index of suspicion for that individual that what's wrong? Why am I urinating often? Why am I drinking water, more water these days? Why am I urinating a lot and all that? Then you can now begin to have, so those are the general symptoms of diabetes. Then you can now have the eye specific symptoms, and which I said most of them are either vision related or non-vision related.
Okay, thank you, doctor. Let's now look at the basic preventive measures. Are there some preventive measures that a diabetic patient can put in place so that, you know, the disease will not affect the eye?
Okay, well, the preventive, in terms of preventing complications of diabetes in the eye.
In the eye.
Yes. First thing that is very important is to ensure the moment there's a family history of diabetes or you discover you're diabetic, is to ensure that you have a regular eye screening, check.
How often?
Yeah, it could be as some people have prescribed a year, an annual eye check, you know, if all is an annual eye check. Particularly if nothing is found, you can just schedule an appointment with the ophthalmologist once a year. So that's important, because if along the line something is picked, and like we said, prevention is better than cure. The moment there are some early stages of this diabetic eye complications, particularly now we're referring particularly to the retinopathy, you know, retinopathic condition, the earlier is picked, the earlier is detected by your specialist, and treatment is instituted early enough, then the better for the maintenance of vision in that eye. So that's the way it works. So in the absence of any other problem, an annual eye check is been recommended. Just have your eyes checked. Yes, so
Are
basically,
there some medication that are meant for diabetic itself that can possibly affect the eye?
you mean medications in
In
treatment
treatment of diabetes.
diabetes? Yes.
Are there some that can, one way or the other affect the eye itself?
Yes, well, most medications have some side effects. Yeah, side effects, but the medications for diabetes are into two broad groups. So is that insulin, or they take medications that lower blood sugar, essentially. So, but no real adverse in terms of complication of those medication. But if you're on the medication, any glaucoma any diabetic medication, you should ensure that you book a regular appointment. So for someone who is confirmed to be diabetic, you may need to be seeing your eye specialist more often.
Okay, let's look at nutrition, because I like to, look at nutrition in all those kind of topics. What's the impact of nutrition on diabetes itself?
Okay, perhaps we should remind ourselves that the risk factors for diabetes, particularly the type 2, are conditions related to bad
nutrition,
bad diet.
Okay.
Yeah, because diabetes wasn't really an issue for us in places like Africa and all that until we started experiencing better standard of living, now start having a lot of fast food joints, and all of that, more cakes. A lot of people are into cakes, a lot of people are into a lot of sugary stuff and all that. So our diet, to a large extent, mirrors what obtains in Western cultures now, such that we now begin to have an epidemic of obesity, people being overweight, and all of these are risk factors for having diabetes. So being overweight, being obese, sedentary lifestyle. We don't move around as often. You just move from your house into your car, into the office. Then you get to the office, you're sitting most hours of the day, you're done with work again, you go back into your car, you're home. So we don't make time for a lot of activities, and World Health Organization has advocated that at least 3 to 4 times every week, 30 minutes of moderate activity. Yeah, like brisk walking will go a long way, to ensure that our weights are kept under control. Then nutrition, of course, moving away from high carbohydrate diets, high sugar diets, processed sugar and all that, to move into more fruits, vegetables, food with a lot of high fiber content, and all of that would really help to be able to keep our body weight under control, because again, like we said, these are risk factors for the development of diabetes. So good nutrition is important. A lot of fruits, a lot of vegetables, a lot of high fiber content in our food and all that. Yeah.
Okay, dear viewer, you are still on to Impact Africa Television, and the show, of course, is Your Health. And of course, the topic we are looking at this beautiful afternoon is diabetes and the eye. And Dr. Olumide Ologundudu has been trying his best to do justice to this topic, looking at what diabetes is, the ways at which we can try as much as possible to prevent it from affecting our eyes, talking about our eye health, because our eye is very, very important. It's a delicate part of the body. And then if you have a question for our guest in the studio right here, you can please dial the number on your television screen. If you have a question or you have a contribution on the topic of today, you can dial the number on your television screen. Let's talk about the treatment. Are there some basic treatment that could help, talking about diabetic eye conditions? Because maybe someone might be out there that has not even taken the bold step to visit the hospital or to try to get some specific treatment, what are the basic treatment that you feel, could help?
So the treatment starts with, like I mentioned earlier on, treatment starts with the most important thing is keeping your blood sugar under control.
Okay.
That's the most important thing. So you must have we call it a glycemic control, optimal glycemic control. So that's most important. So this could come in from both using medication, and lifestyle changes in lifestyle, so lifestyle modification essentially. So, more exercise, more good nutrition and all of that, in addition to weight loss. Then in addition to taking your medication as prescribed. So that is the first and most important key, So when the blood sugar is well controlled, that's a very vital first step. Now, another vital second step, as far as diabetic eye conditions in terms of complications are concerned, is treating the specific problem. So it depends. For some person, it might just be cataract. So what do? Of course, number one, you've checked blood sugar well controlled. Yes, you can now move on. If the cataract is now very significant, you can now go in and now do a cataract extraction. So you bring out the cataract in the eye, you put in a new lens in the eye, so that is sorted out. If it's a refractive error, which is due to either elevated blood sugar or hypoglycemia, as the case may be, treat the cause, which is still blood sugar control. So that is sorted out. Then if it's some other condition, swellings on the lid of the eye, if it's an infection, first treat, ensure sugar is well controlled, then you treat the infection. Because if sugar is not well controlled and you're treating the infection, it's like you're trying to destroy a tree and you're just cutting off the branches. It will keep growing back. So you need to get to the root of the problem. So the root of the problem is the blood sugar, which is abnormally high. So take care of that, but you cannot treat the infection. So if it's a sty, you can use antibiotics, you can do warm compresses and all that, regular face wash if you have an oily skin and all that, Then if it's a chalazion, which is also called a meibomian cyst, if there's a recurrence, first again treat cause. Then you can always surgically incise the chalazion, which is the painless swelling on the lid, and take it out. If it's a chronic conjunctivitis, antibiotics. If you have other complications like vitreous hemorrhage, bleeding into the fluid at the back of the eye, you can first observe that you can have the blood removed from the vitreous, which is called a vitrectomy. If it's a diabetic retinopathy, there are different modalities of treatment. There are intravitreal injections. There's what we call a pan laser photocoagulation. It's the use of lasers, to target the new blood vessels to actually reduce. What you're trying to do is you're trying to deprive the eye of the stimulus of trying to produce more blood vessels. So all that can be taken care of. If it's diabetic macular edema, there are specific, well outlined professional treatment methods or treatment modalities for that. So it depends on what the problem is.
So the most important thing is for the patient to go to the hospital for proper examination, and then the eye specialist will determine or decide which of those process the patient will go through.
So if you're diabetic, you don't have to wait until you begin to develop a problem. Always schedule an appointment with your eye specialist. So your eye specialist will see you and will schedule your appointments as he or she deems appropriate. And if you're diabetic and you notice anything unusual, related to your vision. You know, whether it's gradual deterioration or it's sudden, you need to see an eye specialist as urgently as you possibly can.
Okay, before we round up on the show, I want to talk about glaucoma. You know, glaucoma is also one of the effects that diabetes.
Diabetes could be a risk factor.
Risk factor. Yeah. But you know, glaucoma is like I said, was it last week, that it happens like a thief in the night. Like most of the time, there are no signs or symptoms. How can a diabetic patient handle that?
So I didn't get the question. How can a diabetic patient
handle that? Because you know, most of the time glaucoma doesn't come with, you know, you don't really get the signs, and you don't really, you know, see the symptoms. Or like, you know, you mentioned some other sources whereby you can see them, you can, you know, take step at the right time.
Yes, the good thing about, you know, I mentioned earlier on that there's a need for a regular eye screening, eye checkup. So every time someone who is diabetic goes to the clinic and gets seen by an eye specialist, a comprehensive eye check is done.
Okay.
So we examine the front of the eye, then with specialized equipment, we also examine the inner part of the eye, you know. So that way, so the whole eye is examined from, it's like I said earlier on, it's as if you're moving to a house. So from the moment you enter the gate, the outside gate, you enter into the compound, you start examining. You get to the front door of the house, you examine, you enter into the house, you look in the house, you look into all the rooms. So if there's anything lurking somewhere within the house, you'll be able to pick it. So because the truth of the matter is, you can actually have glaucoma as one of the complications of diabetes, like I mentioned blood vessels on the iris. So you can have what we call a neovascular glaucoma, which could be a complication of the diabetes. So, but in the process of examining your eyes, you know, all of that will be looked at and will be picked, and we'll know what the problem is. So it could be a complication, or you could also develop glaucoma alongside, you know, having a diabetic eye condition. So they are not mutually exclusive at all. And of course, then we are also aware that glaucoma is also a risk factor. Diabetes mellitus is also a risk factor, you know, same as hypertension, risk factor for developing, you know, glaucoma. But specifically, there are special kinds of glaucoma due to the complications from the diabetes. But when the patient's eye has been examined, everything will be looked at, and we'll know, oh, okay, he has glaucoma.
Okay, and that's the importance of constant examination.
Exactly.
Okay, thank you so much, Doctor. What's your pattern shot on the show this afternoon?
So, thank you so much. So we've looked at the need for regular eye examination. We cannot overemphasize that. So for an individual who has diabetes, you don't need to wait.
Have a call here.
Okay.
Hello. Good afternoon. Kindly move away from your television set, please. Good afternoon. Kindly move away from your television set so we can hear you clearly.
Okay. Good afternoon, ma.
Good afternoon. Your name and where you're calling from?
Good afternoon, ma.
Good afternoon. We can hear you.
Good afternoon.
Good afternoon. We can hear you. You can go ahead, please.
Okay. My name is Momo Abdulaziz, calling from Suleja.
Okay. Your question?
Please, I have a small baby, 3 years. Every time he'll be scratching his eyes, and the eyes will be red. I don't know. What can I do?
Okay. The doctor will answer your question. Thanks for calling.
Thank you very much.
You're welcome. Okay. Talking about itching and red eyes.
Okay. Well, from the little information we have, can assume that it's probably most likely an allergic condition, particularly if it's a recurrent condition. So, and it's quite common among that age group, 3 years of age, I think.
Yes, you said 3 years.
So it's an allergic conjunctivitis. There are different types. So usually due to the fact that the body can't tolerate some specific inciting agents around. So the body releases histamine and you begin to have itching and all that. So we can just assume that what it's trying to describe is probably an allergic conjunctivitis. But to be doubly sure and to be certain, to be wise, and I would advise that they consult an eye specialist. So an eye specialist would
know what is
listen,
happening.
Get some other information, examine, and be able to treat appropriately.
Okay. Good afternoon.
Hello?
Hello, good afternoon.
Hello.
Your name and where you're calling from?
My name is Grace. I'm calling from Kogi.
Okay. Your question, please.
Please, my little girl is 7 years now. At times, her eyes will swell up. It will go. It will come back again. Just the swelling up small. It will go again. So I don't know what I can use for her.
Okay. We'll see into that. Thanks for calling.
So 7-year-old,
Swollen eye.
yeah, swollen eye. Well, we didn't get the information about any history of itching, which I'm suspecting there would be. And since it's recurring, it gets swollen and it subsides. So I'm assuming there's probably an associated history of itching. So it could be another case of allergic conjunctivitis in a 7-year-old, which is quite common. But my recommendation again is to see a specialist. If it's an allergic condition, we'll use anti-allergic medications. Could be topical eye drops, could be tablets. But the best thing is just to see an eye specialist and get an expert opinion.
Okay, your parting shot on the show won't be able to pick more calls.
Okay, so like I mentioned earlier on, we need to take very good care of our eyes because they are the portals through which we see into our immediate environment and to our world. If we have a systemic illness of whatever type, we should ensure that we schedule an appointment with our eye specialist and above all, take good care of ourselves, systemically, the whole body, and I'm sure everything will be well.
Okay, thank you so much, Dr. Olumide Ologundudu. Dear viewer, as we wrap up today's discussion on diabetes and its impact on eye health, remember that regular eye checkup are crucial for individuals with diabetes. By managing your blood sugar level, following doctor's advice, and prioritizing your eye health, you can take proactive steps, to protect your vision. And that will be all on the show this beautiful afternoon. I am Precious Obatuishi. Till next week, when I'll be coming your way again, same time, same station. Remember, your health is your greatest wealth.